Kidney stones can be painful and distressing condition, but the good news is that there are various treatment options available to manage and eliminate them. Today we'll explore the kidney stones treatment options, medical interventions, and procedures. In this episode, we will cover the different types of kidney stones, non-invasive and surgical treatments, and what you can expect during and after these procedures. Welcome back to the Kidney Zone. I'm Dr. Mo. Please remember that this video is for informational purpose only. If you have any concerns or questions about your kidneys or about your health, please consult with a healthcare professional. Let's start by understanding kidney stones. What are kidney stones? Kidney stones are hard deposits made of minerals and salt that form inside your kidneys. They can vary in size, ranging from tiny grains up to large stones that fill the renal pelvis. So what are the types of kidney stones? There are the calcium stones. The most common type usually is the form of calcium oxalate or calcium phosphate. Another type is struvite stones formed in response to an infection. There is also uric acid stones, often formed in people who don't drink enough fluids or lose too much fluids or eat high protein diet or have gout. There's also the cystine stones. These are rare and form in people who have genetic disorder called cystinuria. What are the medical intervention? The most important is pain management. Since kidney stones can be very painful, there are some pain management medications. Over-the-counter pain relievers such as ibuprofen, acetaminophen, or naproxen can sometimes help manage the pain. However, in severe cases, stronger prescription pain medication may be necessary as indicated by your doctor. The other most important factor is hydration. Increase fluid intake. Drinking plenty of water helps in flushing out the urinary system, which can assist in passing small stones. However, there are also some medications that help to pass the stones, such as alpha blockers. These are medications that relax the muscles in the ureter, helping the stones pass more easily and quickly with less pain. Examples of this include tamsulosin or Flomax and nifedipine. There are also some non-invasive procedures, such as extracorporeal shockwave lithotripsy or ESWL procedure. ESWL uses shockwave to break kidney stones into smaller pieces that can be passed through the urinary tract. This procedure is typically done as an outpatient basis. So what are the expectations of this procedure? You may be given a sedative or a light anesthesia to help with discomfort, and the procedure usually lasts about 45 to 60 minutes. Afterwards, you might experience bruising and discomfort as the fragments of the stone pass. The other procedure is called ureteroscopy. This is a small scope that's inserted into the urethra and bladder to reach the ureter. The stone is either removed with a small basket or broken into smaller pieces with a laser treatment. So this procedure is done under general anesthesia usually, and the recovery time is usually short, but you may experience mild discomfort and blood in your urine for a few days after the procedure. So what are some of the surgical procedures? There is the percutaneous nephrolithotomy or PCNL. And this is a procedure that is considered minimally invasive surgery for large or complicated kidney stones. A small incision is made in the back, and a nephroscope is usually used to locate and remove the stone. So what to expect? Usually general anesthesia is required for this procedure, and recovery involves a hospital stay of 1 or 2 days. You may have a nephrostomy tube temporarily in place to drain the urine from the kidney to the outside. There is also the option of open surgery. This is rarely used today. However, open surgery involves a large incision to directly remove the kidney stone. It usually is preserved for very large stones or complicated stones that failed or other maneuvers. The recovery time from open surgery is longer, and there is a higher risk of complication compared to the other methods. So, what to do after the treatment of care and how to prevent kidney stones in the future after you get them treated? Hydration. Water intake. Continue to drink plenty of fluids to help prevent new stones from forming. Aim for about 2 to 3 liters of water drinking per day. And also you may require to do some dietary adjustment, for example, calcium stones. If you have calcium stones, reduce salt and protein intake. Avoid food that is high in oxalates such as spinach, beets, and nuts. For people who have uric acid stones, limit intake of high purine foods such as red meat, shellfish, and alcohol. And in general, maintain a balanced diet rich in fruits and vegetables, and consider consulting with a dietitian or a personalized nutritionist for further individualized management. So what are some preventive medications? Depending on the type of stone, your doctor may prescribe medication to prevent future stones. For example, thyroid diuretics for calcium stones or allopurinol for uric acid stones. How about the follow-up after all these treatments? Regular checkup is very important. Regular follow-ups with your healthcare provider are essential to monitor your kidney health and preventing recurrence. Imaging tests may be necessary to ensure that all stones fragments have passed. So, in conclusion, understanding the various treatment options for kidney stones can help you make informed decisions about managing and eliminating this painful condition. Whether through medical intervention, non-invasive procedure, or surgical method, there are effective ways to treat kidney stones and prevent their recurrence. If you found this exploration of kidney stones informative, please make sure to share it with your friends, subscribe to the channel, and give us a rating or a feedback on your favorite podcast platform. For more kidney-related content, please follow us and stay tuned for the next episode of The Kidney Zone.